Assalamualaikum viewers, it's Dr. Mashud Ghazi again. I'm presenting you some important management plans about COVID-19 patients. In this video, we're going to talk about the management of COVID-19 patients at home or at home quarantine. This is a continuation of the first video which has already been uploaded on this channel. First and foremost, it's very important to consider and take into understanding that COVID-19 is primarily a single organ disease. It affects your lungs. Later on, when the disease gets progressed or advanced, it affects your other organs. So it's essential and very important to look after your lungs first and foremost. Before we start on further on, public safety message that washing your hands regularly with soap and water, covering your mouth and nose appropriately with a face mask, and regular use of sanitizers are very important steps. First of all, we're going to talk about the role of lying down. When the patient becomes lethargic, has fever, the tendency is that they're going to lie down on their back. We need to consider that the lungs, most of the lungs are essentially lying on patient's back. So when somebody lies on the back, it puts pressure on the lungs. When the pressure is put on the lungs, it gives the virus an advantage, an opportunity to do further damage to the lungs. So what we need to do is more often than not, do not lie on your back. If you have to lie down, do lie on your front. By lying on your front, you release pressure on your lungs, which would normally happen if you were lying on the back. And this procedure, this method is called proning and is most frequently used in hospitals in patients who are suffering from primary lung disease. So what you could do is, at least every 2 or 3 hours, you can lie on your front, on your stomach or your chest, and take deep breaths in, which will help you with the breathing. Second most important thing is, even if you're in home quarantine, you have to move around, you have to be active. You cannot be lying down or sitting down at a place for a long stretch of time. But moving around, even in your own room or in the garden of your house, you are making yourself active, which will help in getting the circulation of the body up and going. And contradictory to the fact that you're just stationary at a place. Third most important thing is how to improve your breathing. What you need to do is expand your lungs and allow more and more air to go into the lungs. The best way to do is to take a deep breath in, hold it for 2 or 3 seconds or 4 seconds, and then release it out. I'm just going to demonstrate it to you, and then you can do it at home. I'm going to take a deep breath in now. You can do this for 3-4 times at a stretch. It will constitute one cycle, and you can do this cycle every 2 to 3 hours. What this will do, this will further expand your lungs and allow more oxygen to go in, and less damage by the lungs could be done. These are 3 important tips you could do at home, even when you are home quarantined. Obviously, if you're at hospital, that means you are much more severe and you probably won't be able to do much of these. Please subscribe to this channel and pass on this message, very important message, to the patients who are actually, and most importantly, are at home quarantine. Thank you very much.